Welcome back. You're watching the Urban Debate at 9 p.m. I'm Heena Gambhir. The Omicron variant has spread to over 57 countries in 6 continents. The threat has also spread across the country with over 23 cases being reported. Maharashtra has 10 cases. Amid the rising scare, the World Health Organization has gone on to give us some assurance. The WHO has said that there is no indication that Omicron is more severe than Delta. No reason to expect that vaccines are going to fail against Omicron. As per top sources from the Ministry of Health, the centre is keeping a close eye on the evolving global situation with respect to Omicron. As per sources, the centre is hopeful that it will be able to ascertain the severity of this newly found variant in about 10 days from now. Sources have added that there is no evidence that this variant increases hospitalization rate as compared to Delta. So in a way, trying to suggest that nothing to be very worried about, but yes, you need to be extremely cautious. Now, as per reports, there has not been any death due to Omicron variant globally. For now, the focus remains on testing, treating and accelerating the vaccination drive. And on the other hand, Pfizer chairman has made a very important statement, and I quote, "Although 2 doses of the vaccine may still offer protection against severe disease caused by Omicron strain, it is clear from these preliminary data that protection is improved with a 3rd dose of our vaccine." That is what the chairman and chief executive officer at Pfizer had to say. So how should we really interpret the developments that we have got over the last 24 hours as far as Omicron is concerned from the world? That's going to be our big focus over the next 30 minutes. Joining us on the broadcast right now is Dr. Rajiv Jayadevan, Scientific Advisor at IMA. We have Professor M. Vidyasagar of IIT Hyderabad, Head of the National COVID-19 Supermodel Committee. Dr. Subramanian Swaminathan is joining us. He is Director, Infectious Diseases, Gleneagles Global Health City, joining us from Chennai. Professor Gautam Menon, Professor in the Department of Physics and Biology at Ashoka University, Sonipat, live with us right now. We're also joined by Dr. Rajesh M. Parekh, Director, Medical Research, Jaslok Hospital and author, The Vaccine Book. Good evening to all of you. Thank you very much for joining us here on the Urban Debate at 9 on Mirror Now. Dr. Rajiv Jayadevan, I want to begin the discussion with you. Firstly, what do you make of the kind of statements that have come from WHO specifically, WHO trying to allay the concerns of the world that the new variant, the Omicron variant, doesn't appear to be as severe as Delta was?
At this time, we have clinical information that is coming in from South Africa and other nations that there is no evidence so far of severe disease. At least there is no evidence of the Omicron cases being more severe than before. So that's the first part. The second is from today, there were 3 major studies that were released from different labs from around the world, one in Sweden and the other in South Africa. Now, these lab studies, basically, they look at what is called neutralization titers. Neutralization, for our viewers, is basically how effective the antibodies are in binding to the receptor binding domain of the spike protein. I know it's a long jargon. Basically, it's a spike protein. We know what a spike protein is. And the neutralization titer tells us how strongly these antibodies are binding. There is, as expected, there is a decline in the ability of these antibodies. But I want to make this very clear that what they are measuring is something called neutralizing antibodies to a tiny fragment of this virus. Remember, our immune response is like a big military response to a very, very large part of the virus, whereas this particular reaction was only focused on one area of the virus, and that has shown that there's a decline in the neutralizing ability. Now, this does not mean that antibodies are not killing the virus. Sometimes we think that neutralization means killing the virus. It does not work like that. There are other antibodies that recognize parts of the spike protein and the virus that cannot be changed. There are immovable, unchangeable parts of the virus that will permanently be recognized by our vaccines. And that is what we are seeing on the ground here in India, where these vaccines that we're using that are based on the original Wuhan virus are still protecting against severe disease and also against infection. So we have reasons to be optimistic. There is no need to panic with these press releases or lab statements about their findings.
That's a good news that you are bringing to us. Reasons to be optimistic. We have plenty of them. Professor M. Vidyasagar, what are your opening comments? Because, you know, there is a bit of a concern. At least one thing is clear, that this new variant is more transmissible. We know it because the case count in South Africa specifically has gone northwards quite fast. So in India as well, how the number has gone up. What is it that you would like to share with us, with our viewers, about how should we really see this new threat today?
Yeah, thank you. So in terms of the rate at which the cases are growing, we have applied our methodology, which we have been calling the Sutra model. And what that tells us is that the rate at which the infections are growing in the Omicron variant, I should say, is approximately twice as fast as the rate at which the Delta variant is growing. However, we should not read too much into that because you see both in South Africa and in India, a very large fraction of the people had already been exposed to the Delta variant previously. So the two key questions, as Dr. Vasudevan very correctly pointed out, number one, is the Omicron variant going to bypass the natural immunity caused by prior exposure to the Delta variant? And if the answer is no, then we don't have to go. The second question is the Omicron variant more likely to bypass the protection afforded by vaccination? And that is the study that he was talking about. The results were encouraging, as you pointed out. The only comment I would make is the number of patients was very small, just 6 vaccinated people and 6 unvaccinated people. So we need to get far more samples to get a definitive conclusion. But definitely there is nothing that has been published thus far that would justify any kind of an alarm. I agree with both you and my previous speaker on that point.
Justifies an alarm at this point in time. Encouraging words we are getting to hear today after a very, very long time, because till about yesterday, of course, the kind of statements that we were getting only suggested that, you know, probably this variant could become a cause of concern for India as well, the way the numbers are increasing, and we could actually see a repeat of what happened in April and May earlier this year. Dr. Swaminathan, what is...
You didn't ask me yesterday.
Could we have you today on the show? But Dr. Swaminathan, where do you stand on the current situation? What will you say about the kind of statements that have come from the WHO?
I would take it with a pinch of caution, simply because the data is not out to the level that we can be comfortable with. It's still a picture in evolution. I will say the following points. Number one, if you look at hospitalization rates in South Africa, it's rising pretty alarmingly, and ground zero, which is Gauteng province, the numbers are rising very, very fast. That is a source of concern, not panic, but concern for me. I'd like to know more about this, and I know for a fact that oxygen requirement is rising. So therefore, I think in the next 1 or 2 weeks, we'll have more data for us to know what is happening, number one. Number two, also remember, if you look at what the UK Health Security Agency has said, they have classified everything with regards to Omicron with low level of certainty, of course, in the amber or the red region, which basically means they are concerned about it, and it's not something that should be downplayed. While I think we should not be panicking about it, I think people should know that there is another wave coming, and the law of large numbers could apply. What do I mean by that? When we have numbers rising so fast, even if the attributable risk is very, very small, if so many people fall sick all at the same time, the number of people who will need care will rise. And that is not a situation we really look forward to. Finally, one point that I really have to make. Our vaccination rates are nowhere near what we need it to be. If you look at what's happening in Western Europe right now, and they are divided, there is a wave all over Western Europe in terms of increased cases. But the mortality is primarily limited to countries where the dual vaccination, not single, dual vaccination is under 67 to maybe 70%. We are nowhere near that number. And I am really concerned that our vaccination status has still lagged behind. And not to downplay what the government has done, they have worked very hard at doing this. But I suspect that we should be pushing even harder, because I think that would be a mistake. Because imagine sitting on such a huge tranche of vaccine doses, and then we get hit by a wave. It just looks very, very, very bad, and we will be the laughing stock. If not, we'll just have ourselves to blame. So that is a point of concern. And for that reason, I would sincerely urge everybody who's listening to get and complete their vaccine course as quickly as possible if they haven't done so. Because do not think of this as a common cold, because the law of large numbers could apply, and that's not something where you want to be caught.
Okay, interesting point you're making. And Professor Gautam Menon, now I want to ask you, do you agree with the thoughts shared by Dr. Swaminathan? Is the vaccination drive of the country lagging behind? We really need to be more aggressive on that front, because the cases that we have seen coming from South Africa are largely among people who are unvaccinated. So it is impacting people who haven't taken any dose yet.
I agree very substantively with Dr. Swaminathan. I think that we still have to wait for more data to come in. It isn't possible at this stage to be very definite about levels of severity, levels of transmissibility, etc. We do know that it is more transmissible. We do know that it is immune evasive. So these are all very negative. And the only thing that we're not completely sure about is levels of severity. There is some reason for some positivity there, because in Pretoria, we're not seeing levels of oxygen use, ICU use, etc., commensurate with the rise in cases. But we are seeing a very, very sharp increase in numbers of cases. And overall, this is not a good sign. I agree again that vaccination is crucial. But I see vaccinations as just one part of a bunch of different interventions that are also individual in nature. We should be worried about masking. We should be worried about ventilation. We should be worried about crowded spaces. And we should be worried about getting the second dose to as many people as possible. And the first dose to the people who have not been vaccinated so far, which is still around 15 to 20% of our population. We should worry about all of these. And certainly vaccination is the public health tool that provides you some level of protection against severe consequences of the disease. I would again reiterate that all of the information is not in as yet. And it's important to have that information before we can project what might happen in the future. It's still too premature to say anything.
But, there's then another point, Dr. Rajesh, that I want to specifically focus with you, and it is about the mutations in the virus that keep on happening all the time. So the situation that we are seeing right now, where we don't have enough information about this new variant of concern, there is a bit of a confusion here. There is a bit of panic as well among many people. Many people have started talking about a need for booster dose too. So how should we really approach this kind of a situation? Because the virus will keep on mutating, and the mutations this time in Omicron variant are a cause of concern because there are too many of them.
So that's indeed a rhetorical question. I could detect the answer implicit in the question itself quite clearly. There are other substantial reasons to go ahead with the boosters. We'll come to Omicron in a moment, but since you started with the booster aspect of it, it's about time we started giving booster doses. A substantial portion, particularly of our healthcare workers, and of course of the immunocompromised patients, have had their second dose long ago and should have by now had their boosters. The corollary to this also is that a large number of vaccines are going to head into the dustbin very soon. I know what's happening in our own hospital. At the Just Look Hospital, we have exactly 30,000 doses left. By the end of March, all of them are going to go in the dustbin, and some of them already heading that way.
Right.
And it is about time we gave boosters. But there is something else that is not confusing at all. So while our focus is on Omicron and what's happening in our country, there are two other things which have to be in our peripheral vision. One is right now what is happening in Gauteng in South Africa, because that's where Omicron at least was first detected officially in the last week of November. And what we're seeing in Gauteng today is a bit disconcerting. We're seeing an alarming increase, not just in cases, that was expected, but a number of patients who are getting hospitalized.
Dr. Parikh, I'm just interrupting you there. WHO's press briefing has begun. Let's quickly listen in.
It had little competition. It will therefore be important to monitor carefully what happens around the world to understand whether Omicron can outcompete Delta. For that reason, we call on all countries to increase surveillance, testing, and sequencing. Our existing diagnostics work both PCR and antigen-based rapid tests. Emerging data from South Africa suggests increased risk of reinfection with Omicron, but more data are needed to draw firmer conclusions. There is also some evidence that Omicron causes milder disease than Delta. But again, it's still too early to be definitive. Any complacency now will cost lives. Many of those who don't die could be left battling long COVID or post-COVID condition, a disease with debilitating, lingering symptoms that we're only beginning to understand. To help us build a clearer picture of the severity and symptoms of disease caused by Omicron, we're calling for more countries to submit more data to our clinical data platform using an updated case reporting form available on our website. New data are emerging every day, but scientists need time to complete studies and interpret the results. We must be careful about drawing firm conclusions until we have a more complete picture. Every day, WHO is convening thousands of experts around the world to share and analyze data and drive research forward. For example, the Technical Advisory Group for Virus Evolution is assessing Omicron's effect on transmission, disease severity, vaccines, therapeutics, and diagnostics, and the effectiveness of public health and social measures. The Joint Advisory Group on COVID-19 Therapeutics prioritization is analyzing the possible effects of Omicron on treatment of hospitalized patients. The Research and Development Blueprint for Epidemics is convening researchers to identify knowledge gaps and the studies needed urgently to answer the most pressing questions. And the Technical Advisory Group for COVID-19 vaccine composition is assessing impacts of Omicron on current vaccines and determining whether changes to vaccines are needed. Once again, I thank the scientists in South Africa who have been working closely with WHO to help us learn more about Omicron. Building capacity across Africa is a key priority for WHO, which is why next week I look forward to joining the International Conference on Public Health in Africa, hosted by the African Union and the Africa Centers for Disease Control and Prevention, which will bring together researchers from across the continent to discuss some of the most pressing scientific questions about COVID-19. Even though we still need answers to some crucial questions, we're not defenseless against Omicron or Delta. The steps countries take today and in the coming days and weeks will determine how Omicron unfolds. If countries wait until their hospitals start to fill up, it's too late. Don't wait. Act now. We're running out of ways to say this, but we will keep saying it. All of us, every government and every individual must use all the tools we have right now. All governments should reassess and revise their national plans based on the current situation and their national capacities. Accelerate vaccine coverage in the most at-risk populations in all countries. Intensify efforts to drive transmission down and keep it down with a tailored mix of public health measures. Scale up surveillance, testing, and sequencing, and share samples with the international community. And avoid ineffective and discriminatory travel bans. I'm also pleased that France and Switzerland have lifted their travel bans on Southern African countries. And I urge other countries to follow their lead. To France and Switzerland, merci beaucoup. All individuals can reduce their risk by keeping a safe distance from others, avoiding crowds, wearing a mask, cleaning your hands, and meeting outside if possible, or in a well-ventilated space indoors. And please get vaccinated if you can. We can save lives from Delta right now. We can prevent Omicron becoming a global crisis right now. And we can prevent other variants emerging right now. This virus is changing, but our collective resolve must not. Christian, back to you.
Thank you very much, Dr. Tedros. Let me now open the floor to questions from the media. To get into the queue, please, and to ask questions, you need to raise your hand using the raise your hand icon.
So a number of important messages there coming from the World Health Organization. We just heard the DG there giving one very clear message to the entire world. Don't wait, act now. Any complacency now is going to cost lives. The message is very, very clear because we don't have enough information on this new variant of concern. But as the world is in a wait and watch mode, WHO's message is that it is very important that people get themselves vaccinated. Don't wait, act now. Let's straight away go across to my guests who continue to be with us at this point in time. Dr. Rajesh Parikh, I had to interrupt you earlier because the WHO's press briefing had become. Do you think, after listening to the WHO DG, you feel that India really needs to be a little more focused on its vaccination drive, and we have to together ensure that this Omicron doesn't become another Delta?
Oh, absolutely. But regardless of the press conference, I could hardly believe this was a live press briefing because I did a little bit of mental math and I heard nothing new. 25% of what he had to say was said a few hours ago, earlier today. Another 25% has been said over the past 1 month. And the balance 50% is what they've been saying over the past 1 year. So I really failed to see anything live in what was being said, which has not been said over the past 1 year. But you know what I was telling you, and this may be a little nuanced, so I may kind of
Sorry to interrupt you, sir, but is this because there is little information that is available?
Oh, of course. I mean, listen, there's always going to be little information available. When you're talking of a current thing, obviously the information is limited. But on the other hand, there are enough inferences that we can draw from limited information. For example, in January of 2020, with very little information available, there were robust mathematical models, which we wrote in our first book on the coronavirus, which have all held up. And the book we wrote in Jan 2020 has had about 50 plus predictions, which all turned out to be true. So yes, there is enough information, but that's not a deterrent. But if I may, there's something I want to kind of engage our viewers in. And that is, yes, you're right. Focus on vaccination, focus on boosters, focus on Omicron in India. But there's something in the peripheral vision, which is very important. On the left side, let's look at what's happening in Gauteng. Large number of people suddenly over the last 2 days heading into the hospitals, cause for concern. Then we are seeing a shift in the profile to children between the ages of 2 and 14 now testing positive, cause for concern in India. Because in India, mind you, there is a paucity of pediatric beds. We have 20,000 pediatricians against the estimated need of 20 lakhs. So very few pediatricians. That could become a potential problem if it spreads amongst children in our country. And then what we have to see, and here's a bit of math. Please pay attention to the concept. The numbers are arbitrary. They could be turned around anyway. Okay. And here's what it is. Let's say you have the Delta variant, which is not very infective, but is lethal and severe. And you have another one like the Omicron, which is transmissible. And then we may feel reassured that it doesn't cause severity of disease. But as has been pointed out, if a large number of people fall ill, even if a smaller percentage, so let's say 1% of 1 lakh is going to be much larger than 5% of, say, 10,000 people or 500 people. Now, here's the problem. And this is what is not being talked of in our obsession with COVID. Let's say a large number of people end up in hospitals what happens to people with other diseases, as happened during the second wave.
We've seen a glimpse
What
of that,
happens?
sir, during the second wave as well. I'm sure those devastating visuals, nobody in the country is going to forget, that we got from the two of the most metropolitan cities in the country, Delhi as well as Mumbai. I want to quickly go across to Professor Vidyasagar as well at this point in time. Sir, we all seem to agree at least on one point, that since there's little information even on the issue of Omicron causing milder diseases, there is very little information. So there is a cause of concern. I want to now ask you all, in fact, what is the way forward? What should really be done from here on? How can we ensure we don't see a second wave kind of a situation? Let's begin with Professor Vidyasagar.
Okay, well, yeah, I will answer your question, but I just want to highlight one point which I think none of the other panelists has mentioned thus far, and that is that the vaccination rate in South Africa is 41%. So 59% of the people are not vaccinated, and the overwhelming majority of these people would be the young people. And as you have pointed out earlier, most of the people who are catching this Omicron variant are in fact unvaccinated. And that would also perhaps explain why the symptoms appear to be simpler, milder, because they are younger people. Now, coming back to the question of will we see a second wave-like situation, we should remember one very key point. The Delta variant hit India around about March 1st, a little bit before, but we can say March 1st for the sake of argument. And our public vaccination program also started on March 1st. Between January 16th to March 1st, only the frontline workers were vaccinated. The public was left completely defenseless. So essentially what happened with the Delta was that it hit 100% vaccine naive population. So it went through the population like a wildfire. Now the situation today is that about 95% of Indian population has been exposed to the virus. This is what we call reach in our model. The seropositivity rate, which was around 65-70% in August, has now climbed upwards of 80%.
Right.
No, so let me just repeat the 2 points I made in response to Dr. Vasudevan's comment. The two things we need to look at. Number one, do people who have developed immunity due to prior exposure to Delta lose that when they're exposed to Omicron? If the answer is no, we don't. I mean, when I say it's not yes or no, obviously, some people will be vulnerable, but if it's not substantial loss in immunity, we don't have to do it. Second one is, if you have been vaccinated for the current vaccines we use in India, Covishield and Covaxin, do those continue to give protection against the Omicron variant?
Right.
If both of those things are true, then we don't have much to worry. Our worst case projection is about 150,000, 1.5 lakhs cases peak, somewhere in the middle of February. That is assuming that vaccine immunity is totally gone and some loss of immunity.
Right. All right. I want to also now go across to Dr. Swaminathan. Your closing comments. What should be the way forward? Very quickly.
So let's also remember that beyond just the Delta wave hit us first and the rest of the world was able to help us. This is going to hit the whole world at the same time.
Yes.
Everybody has to help themselves. Let's make that very, very clear. Nobody is going to come to anybody's rescue. And second, data from South Africa seems to suggest that previous infections with COVID does not protect you against Omicron. So that's a bit of a problem as well. Hospitalizations are rising. So let's not downplay this as a common cold. This is a serious concern. We don't know if it's a Himalayan problem, but certainly it is not something which can be written off as a molehill.
Okay.
As of right now, it is up to us to make sure we get adequately vaccinated and take good COVID appropriate behavior in terms of masking and social distancing and personal responsibility for this. Otherwise, I suspect we're going to end up in a bit of a hole. How big the hole is going to be, I think the next 3 to 4 weeks will tell us.
Absolutely. Professor Menon, 10 seconds. I have very little time. Yes.
Let's keep careful track of where cases are going up. Let's try and find out why those cases are going up through sequencing. And let's be as careful as possible with COVID-appropriate behavior, just as Dr. Swaminathan said.
And Professor Dr. Jayadevan?
Dr. Tedros said something here. He said tailored mix of public health mechanisms, public health measures. I would highlight what Dr. Menon said. Dr. Gautam Menon said the word ventilation. I think that word has been lost in our public messaging. The importance of improving ventilation of indoor spaces, I think that's one thing that we must focus on in the months forward.
All right, I appreciate all of you, gentlemen.
I would like to apologize to Dr. Rajiv. I had
Yes.
been calling Vasudev and I had incorrectly noted down his name, so my apologies.
Thank you, Professor. Thank you, Professor.
Thank you. Thank you very much, all of you gentlemen, for joining us here on this debate on Mirror Now. We'll, of course, all need to be very, very cautious. Let me reiterate what we've been focusing on as far as this issue is concerned. We're not here to create any kind of panic. We're here to ensure you are aware. You know everything that's happening around the world as far as this Omicron variant is concerned, so that India doesn't see a repeat of what happened during the second wave. So it is important to not panic, but to be cautious at the same time.